Hey everybody, tonight I want to talk about pre and post breastfeeding weight checks, when, why, and how to do them correctly. Weighing a baby before and after a feeding can be a really useful tool in lactation care, but it's not something that every breastfeeding dyad needs to do. Now, when used appropriately, pre and post feeding weight checks can provide us really valuable insight into milk transfer, how much milk the baby is taking. But when we use it excessively or with improper technique, it can really cause unnecessary anxiety. And I see this in my practice all the time. In the lactation world, many lactation consultants will use pre and post breastfeeding weights as a guideline, but sometimes parents will get their own infant scale and go way overboard on tracking every single drop that goes into the baby. Now, there is a time and a place for everything, and we're going to talk about that in this video. So when should you be doing pre and post breastfeeding weight checks? If there's any concern about milk transfer, if your baby is struggling to gain weight, they're exclusively at the breast, and you're trying to figure out if they're actually transferring enough at each feedings, if you're trying to see if they have an inefficient suck, and it really is a big piece of tongue tie babies. Is that baby looking like they're feeding really well, but not actually feeding well? And we can then use that information after a release to see if the release was effective and if baby's being supplemented, when we can actually transition off of that. We can also use pre and post feeding weight checks for premature or medically fragile babies. So if you had a preemie baby and you've been bottle feeding them and you're working on coming back to breast, it can be a very useful tool for that. We can also use it for milk supply if you have either a low supply or even a suspected oversupply. Understanding how much milk the baby transfers in any given time can really help know if we need to keep supplementing the baby by a bottle or with a tube SNS system, or if we need a block feeding strategy, if maybe that oversupply fast flow is contributing to reflux or gassiness, and it can help us figure out a plan to help manage those issues. It can also track feeding progress over time. If you're working with a lactation consultant because you're triple feeding, which means you have unexpected twins, you are feeding a human baby and feeding an electric baby, where you're breastfeeding, pumping, and then supplementing, we can use those pre and post breastfeeding weight checks to see when we can wean off of pumping and supplementing and go back to just the breast. So many reasons why we would actually do those pre and post feeding weight checks. So now let's talk about how to do them. Well, first, we really want to make sure that we have a highly sensitive hospital grade scale. The scale, I prefer using grams instead of ounces to detect small changes. Most hospital grade scales that a lactation consultant would use or your pediatrician are accurate to 2 grams. Depending on the age of the baby, a 5-gram scale can be okay. But breastfed babies really transfer small amounts. So we want to make sure, especially for babies under a month old, that we have a very accurate scale. 1 gram equals 1 ml or milliliter of milk. So a scale that only measures in ounces, where 1 ounce of breast milk is 30 grams, lacks the precision needed to really assess accurate intake. So let's say, for example, the baby transfers 20 mLs, 20 grams. A scale that rounds to the nearest half ounce, or about 15 grams, or even a full ounce, 30 grams, may not detect the intake entirely or overestimate by nearly 50%, leading to unnecessary concern or false reassurance. So a highly sensitive scale really ensures accurate tracking and better feeding decisions to make sure we're making the right plan for you and your baby. The reason I prefer grams is the calculation is much more complicated in pounds and ounces, since it's a system of 16. So if your scale says 6.5 pounds, that's not 6 pounds, 5 ounces. That's 6.5 pounds, which is 6 pounds, 8 ounces. So it's like ordering turkey at a deli. A quarter pound is 4 ounces. 4 plus 4 plus 4 plus 4 is 16, right? 4 fours is 16. So your scale needs to actually say pounds and ounces. And again, my brain, it's just too complicated. So kilos and grams are a system of 10. Much easier calculation. Okay, so once we have our scale, we now want to weigh the baby in just a dry diaper. We want to make sure that the scale is flat and level, that it's not wobbly. If you need to put something down under the baby to prevent them from moving, you want to make sure that the scale is zeroed out. So the scale should say 0 all across the board before you put the baby on there. I prefer dry diaper weights because if your baby pees or poops during that feeding, that was inside of them. It gets counted to their end final weight. So I don't like doing naked baby weights because it's inevitable they're going to pee or poop in that. All right, so weigh the baby, write the number down. You will forget. I forget. Write the number down. Then go feed the baby for however long it takes the baby to feed, and then weigh them in exactly what they were in when you weighed them. So if you weighed them in just a diaper, weigh them in just a diaper. If you had to swaddle them so that they wouldn't be too wobbly on the scale, you have to weigh them in that swaddle again, otherwise it won't be accurate. All right, so once they've breastfed, you're then going to weigh them, and then you're going to calculate the difference. So you're going to take the post-feeding weight minus the pre-feeding weight, and that's how much they took. So again, 1 ml or 1 gram equals 1 ml of milk. So it's a 1-to-1 correlation. So let's say the scale said 3.500 grams, which is 3.5 kilograms before baby feeds, and then they are 3.560 grams or 3.56 kilograms or 3,560 grams, again, scale of 10, after baby feeds. So 3.5, 3.56, right? You're going to take 3.56 minus 3.5, and that's 60. So 3,560 minus 3,5 is 60. The baby took 60 grams, which is 2 ounces. There's 30 grams per ounce. A lot of math. Go rewatch the video so you can catch it, okay? But that tells you how much the baby took. I use a conversion app called Rapid Tables that helps me convert from kilos to pounds and ounces so I can tell parents how much the baby weighed. And the conversion is 30 grams per 1 ounce of breast milk, so you know how much they actually transferred. Now, when we're doing all these pre and post breastfeeding weight checks, we want to remind ourselves that this is one data point in time. It's one piece of the puzzle. How much a baby takes at any given feeding varies by the time of day, how long it's been since the last feeding, how much they took at the last feeding. So we want to use that in combination with their weight gain over time, the quality of the feeding, and all of those other information pieces when we're making our clinical decisions. All right. Now, if the baby needs it, then we're using that as the piece of the puzzle in order to be able to know when can we wean off of a triple feeding plan? Does mom have enough milk, or is there plenty of milk there and baby's struggling to transfer? So this can also help guide us. If baby only transfers 1 ounce at the breast and then mom pumps 3 ounces immediately after, that's a baby issue and not a mom issue. But let's say the baby only transfers 1/2 ounce and then mom doesn't pump anything after. That is a low milk supply issue. Now, it could be a baby issue, but it could also be a mom issue. So we're using that information to then help figure out, is this a baby issue or a mom issue or both? All right. Now, weight fluctuations are normal. If you're tracking those weights over time, we're using scales as a data point. And if at any point in time you're finding that the scale is giving you anxiety, definitely call in a lactation professional to help figure out what's actually going on. All right. So pre and post feeding weight checks are a really valuable tool when used appropriately, and we need to be using them to interpret feeding in the context of baby's overall growth and development, diaper output, and feeding behaviors. When in doubt, reach out to a local lactation consultant. I'm also available for virtual and in-person lactation consultations. Now you know. All right, so now we're ready to weigh our baby. So we have our scale, and we're going to turn that scale on. We should see all of the numbers All right, now I have it in kilos and zeros. Now, if I have a really wiggly baby or the scale is cold, I'm going to put my mat or towel down first, making sure that the edges aren't hanging off. And you'll now see that you're weighing this towel. So we want to hit the tear or 0 button so that it goes back to all zeros. Then I'm going to lay my baby down from butt to head, gently rolling that baby down so that we can get an accurate weight. Right now, this is 570 grams for my little baby. So I'm going to take my baby off. I'm going to tear it, and I'm going to go one more time to make sure that I have 570 grams. Now, if there's any adjustments, if the table is wobbly, if the scale is wiggly, if the baby's super wiggly, you're going to see a different number here. You want to make sure you get that same number twice. So if I were to tear this out and mom is going shh, shh, you'll see those numbers go all over. If the table is wiggly, you'll see them, look, it's registering at 620. So you want to make sure you have a stable table, that the scale isn't wiggly, and that you don't have too wiggly of a baby. I tend to find if you put them down butt to head, gently roll them down, they won't startle as much. You can also swaddle the baby if you need to keep them still, but you'll then need to swaddle them again when you do your post-test weight. So whatever they were in on the scale before, make sure they're in that same thing on the scale if you weigh them after.